Hey everybody, this week we will be going over the assessment of the ankle. So usually when we're dealing with a twisted ankle, one of the first things that I notice is how they walk from the front of the office back to our exam room. I want to see if there's any changes towards their gait, and that allows us to kind of determine kind of how severe the ankle sprain or strain is. Once we have the patient in the exam room, we want to have a decent history of how the ankle injury happened and kind of build a relationship that way. The next thing I want to do is look at the ankle. I want to see if there is any bruising, swelling, point tenderness anywhere in and around the ankle. That's going to help us kind of determine some of the severity of the ankle injury itself. What I also want to do, and that's important for us clinicians, is we want to make sure and rule out any sort of severe ankle tear of one of the ligaments, muscles, or if there's a fracture in the ankle. One of the best ways that we can do that is following the guidelines of the Ottawa ankle rules, and that just allows us to palpate the bottom 6 centimeters of both inside and outside of the ankle to see if there's any palpatory tenderness, but also along the foot on the outside at the base of the 5th metatarsal and the navicular. I would also like to communicate with the patient in terms of can they walk, can they put pressure on their foot, and that allows us to kind of differentiate, do they need an x-ray before we need to start treatment. The next few things along our assessment is I want to see how much our patient can move the ankle. So I'm going to have my patient move the ankle up towards her head and then back towards me. We're going to take the toes towards the inside and then towards the outside as well, and then just have them do a full 360-degree circle. I want to visually see how well she can move the ankle. After that, I'm going to take over and essentially move the ankle myself, allowing for proper communication if there's anything tender, sore, restricted, anything like that from the patient's point of view. I then want to test a little bit of the ankle stability, some of the ligaments. So I'm going to be applying a little bit more pressure in different ways of the ankle, seeing if there's any additional movement that we don't want when we compare it to the other ankle. There may be scenarios where we have to wait a few days before we can actually do a proper assessment of the ankle after the injury. Sometimes it's just too much swelling, too much pain for us to do our part in terms of diagnosing the ankle and proceeding with treatment. During those first 48 to 72 hours, we can follow that principle of ice, rest, and compression with elevation. After that, though, once we get a proper diagnosis of the ankle, we want to start rehab, strength, improve range of motion as quickly as possible for the best maximal results of getting our athlete back to walking properly, back to their everyday life, and then eventually back to their sport.